and your anatomy and physiology. If you know these areas, it would help you greatly when you first start coding and learning all about the different body systems, because every body system mainly has a different code. Whether it's your left arm or your right arm, or your left leg or your right leg, there's a different code for each of these body systems. Also, with medical billing and coding, you must be able to read the documentation provided in the doctor's notes, the progress notes, the nurse's notes, and you must understand how to decipher what the diagnosis is and how you will go about coding the diagnosis. The main area for me that I had a hard time learning in was the evaluation and management services. With these services, you have to code for new patient or established patients, um, and how long that the doctor spends with those patients. There are different codes for that. Also, with whether it's critical care patients, how long the doctor spends with that patient. There's different code for the times. With newborns, there's different codes for the newborn, infants, and children according to their weight. There is actually codes for face-to-face doctor visits, non-face-to-face discussing things with the doctor over the phone or the nurse. There's different codes for that. Also, there's a code for people that go in for workman compensation. And I never really thought about that, but all these areas need to have a certain code in order for the insurance companies and other providers to submit the claims where they can get reimbursement. But learning all these different areas made me think that I probably would like working with a specialty area. For example, with orthopedics, you know about the bones and the joints and the springs. So working with those codes day in and day in and day out would help you understand um, how you would go about coding certain procedures. And then I think as I get more experience, and I would branch out to other different areas where coding is acceptable. So I have learned a lot over the last few months, and the outcome of it all is that you must be organized. You have to have time management in order to make sure that you have time to read the documentation and read the doctor notes, the nurse's notes, and other documentations for you can come to the correct code for a procedure or a diagnosis. Um, so this has been a great learning experience, and I'm looking forward to going out into the workforce and working as a medical billing and coding specialist.